everybody, and welcome to the webinar. This is Ideas by Interpreters, episode number 11. We're here with Judit Marin on interpreting for chemical dependency patients. Judit, thank you so much for joining us. I'll let you take the floor here and share your screen with the presentation.
All right. Good morning, everyone. Thank you, Caroline, for that introduction. And thank you to Lingo for giving me the opportunity to present this workshop. I'm delighted to be back. And thank you to all of you who are listening. And it's always a pleasure for me to share any knowledge and experience with colleagues, and always with the ultimate goal to help you and me to be the best interpreters we can be. So thank you for being here today. And the topic of today's webinar is interpreting for chemical dependency patients. And I divided this webinar in 3 parts. In the first part, I will talk about the challenges that we interpreters face when we have to interpret in this kind of setting. Then I will talk briefly about the most commonly abused drugs and prescription drugs and other substances. And then I'll go into detail about specific terminology related to chemical dependency, and I'll give you several examples. And all the text, all the examples, all the terminology that appears on this presentation is available to you in a handout that Lingo can share with you at the end of this presentation. There's also a handout with a glossary in Spanish and Russian, Arabic, and Korean. I'm working on glossaries in Chinese, Vietnamese. I don't have those available, and certainly there's not much in those languages of service, unfortunately, on this topic. So I'm really working hard on getting those available for colleagues and friends. So, and we'll have some time for questions throughout the presentation, if you have any. So chemical dependency is a very complex topic for many different reasons. When I look back at my career as medical interpreter, certainly the appointments at chemical dependency facilities always come to mind as the most challenging and difficult ones for me. So to illustrate this complexity, hold on one second, I'm trying to move to the next slide. There we go. Sorry about that. So to illustrate the complexity of interpreting a chemical dependency, I would like to start with a short listening exercise. As interpreters, part of our job obviously is to be good listeners. So for the next 6 slides, I will ask you to listen to what I call the voices of dependency. So imagine that you have to interpret in this kind of setting in chemical dependency. Or a chemical dependency recovery program, for instance, and you will listen some examples of things that I heard throughout the years when I interpreted in these settings. And I want you just to listen and try to interpret in your language of service. Dear Heron, I love you so much. You are the first thing that I think about when I get up in the morning. We have a clean and sober house. When I was drunk, I was a complete asshole. I felt like shit. I was messed up. There are a lot of trust issues to deal with. You are experiencing withdrawal symptoms. You are in denial and you are an enabler. Okay, so the first voice that we heard was, Dear Heron, I love you so much. You are the first thing I think about when I get up in the morning. In chemical dependency, a lot of the testimony that you're going to hear, it's going to be very emotional. A lot of times people have to do homework, and sometimes homework, for instance, maybe to write a goodbye letter to your substance abuse. So this would be an example of somebody who has an addiction and their drug of choice is heroin, and they have to write a goodbye letter. So sometimes things are very emotional. people cry a lot, and certainly there will be times that you will feel like crying too. So I certainly experienced that. We have a clean and sober house. This is very typical chemical dependency language. If I do a literal translation of the word clean in this sentence, meaning like I cleaned my house today, like I mopped and I vacuumed, obviously this is not going to work because the word clean here means something else. This is a typical example, for instance, in a group setting where maybe you are not interpreting for the patient, but you're interpreting for the parents, for instance. Maybe the patient is a teenager who is in a drug recovery program, and the patient is a Latino Hispanic and he speaks English. Maybe he doesn't even speak Spanish, and you are actually interpreting for the parents or relatives of this person. And sometimes when the parents introduce themselves, they have to say something like this: "We have a clean and sober house." Here, the word clean means that there are no drugs in the house, or the whole sentence means that there's no drugs or alcohol in the house. So again, be careful with literal translations or interpretations. Another thing that happens in chemical dependency is that you will hear a lot of profanity and foul language. And as professional interpreters, we are following a code of ethics that tells us that we have to interpret everything completely and accurately. So we have to be ready to interpret this kind of language. So um, some of you may feel uncomfortable, but you have to do it because this also shows the state or the emotional state of the person. And another thing that's challenging about this for some of us is that we might speak a language that has many variations or dialects. And some of this language varies a lot between countries and regions. So what I suggest is that if you know that most of your patients come from a specific geographical area, for me, for instance, I live in Northern California, and most of the patients I interpret are Latinos from Mexico and from Central America. I'm originally from Spain, so I learned how to say this kind of language in Mexican Spanish or Central American Spanish. So the communication is better. There are a lot of trust issues to deal with. A lot of the vocabulary and terminology in chemical dependency is very similar to mental health. So if you've done a lot of mental health, chemical dependency will not be as hard for you. And this is due mainly to the fact that a lot of patients who are in chemical dependency have been diagnosed or have what they call a dual diagnosis. Dual diagnosis is a term used when someone experiences a mental illness and also a chemical dependency disorder simultaneously. So a lot of people who are in chemical dependency also might be depressed. Some of them might be bipolar or have other mental conditions. And therefore, a lot of the interpreting you're going to be doing basically is therapy, which combines a lot of chemical dependency language and mental health terminology, like this example right here. You are experiencing withdrawal symptoms. This is a pretty straightforward sentence. There's nothing complicated about it. You should know how to say withdrawal symptoms in your language of service. But I put this here as an example of the fact that we always have to be ready for what's coming next. And chemical dependency, most of the time, you will be interpreting simultaneously because you will be probably in a group setting. So somebody, a therapist tells the patient, you are experiencing withdrawal symptoms, chances are that the next sentence will be a description of the symptoms. And so to be ready, I would recommend that you learn at least 2 or 3 of the most common withdrawal symptoms for substance abuse. It could be insomnia, severe vomiting, tingling, profuse sweating, hallucinations, etc. So So learn those so you're ready. And by being ready, basically what we do is that we're better interpreters. And finally, we heard you're in denial and you are an enabler. So this is very typical chemical dependency language. You probably understand what this means. Obviously, the word denial and enabler. And I'll explain what some of these terms mean later on in the presentation. And some of these words may have an equivalent in your language of service, others may not. And if they don't, what you probably will have to do is that you will have to explain what the word means. So that means that while you interpret simultaneously, you probably, instead of using just one or two words, you might have to say a whole sentence, which makes your interpreting work more difficult. So, what are the challenges for us interpreters? And the first questions I would ask you is, what do you know about chemical dependency? Most of us, what we know about this topic is through the press, newspapers, radio, TV, and by shows on TV. So uh, unless you have some personal experience or a friend or relative who's been through this, most of us, our knowledge is limited or based on fiction. And the fiction might be really good and close to reality. Also, when I trained as an interpreter many years ago, and even now, most of the trainings don't include chemical dependency. And I hope this changes because chemical dependency is huge and there's an opioid uh, crisis in this country, and these services are being needed more and more. So another thing is that there are not very much glossaries on this subject. There are certainly a lot of English glossaries, but in other languages, they're very hard to come by. There's some stuff in Spanish, but in other languages, what I've been doing is work with colleagues who have been translating my glossaries for me, and those are the ones that I share with you. The language is very complex, and this makes very difficult for me to interpret in these kinds of appointments. There's a lot of slang and low register kind of language. People in the appointments may say chasing the dragon, dope. They might use words like big H, mollies. And so if you don't know what molly is, so you might say molly and it's okay. So I suggest also, and I recommend that you pick two or three of the main substance of abuse that you usually interpret for, and that you look the slang for that drugs, for those drugs. So you become familiar with it, and then you find a translation of your language of service. So somebody uses big H referring to heroin. And I'm interpreting to Spanish. Instead of saying big H or literal translation, I can use a slang word for heroin in Spanish or Vietnamese or Russian. And any word, slang word, it doesn't matter as long as it's slang or low register. Another challenge for interpreters is that in a chemical dependency appointment, you might have to use all modes of interpretation, simultaneous, consecutive, and side, possibly all of them in the same visit. Most of the appointments, you will be doing simultaneous interpretation. So if you are not yet comfortable with this mode of interpreting, simultaneous, you should probably not do these kinds of appointments because chances are that you will be interpreting in a group setting. But sometimes, if you're interpreting a group setting, let's say that suddenly the patient you're interpreting for wants to speak in Spanish, for instance, in my case. So when that happens, I have to stop the simultaneous and I have to switch into consecutive because the rest of the group don't have headsets, and I'll have to interpret in a consecutive mode. And sometimes patients get handouts, and my experience in chemical dependency is that most of the handouts are in English, and you might have to help the patient side translating the text. So what is chemical dependency? Chemical dependency is that we call also drug addiction, drug abuse, or substance abuse. Nowadays, chemical dependency is a term that is widely used in this setting. For instance, where I live, there's a Kaiser recovery program for chemical dependency, and that's how it's called, chemical dependency recovery program. So the words drug addiction and abuse have been dropped and instead of that, people are using more chemical dependency. So usually when we talk about chemical dependency, we're talking about three major substances: alcohol, illegal drugs or illicit or street drugs, and prescription drugs. So I'll talk very briefly, because this is a short webinar, about the opioid epidemic. If you listen to the news, you probably heard that the United States is going through an opioid epidemic. In 2017, these are CDC statistics, 72,000 people in the United States died of a drug overdose. This is all kinds of drugs, prescription drugs and illegal drugs. And of those 72,000, more than half died of a prescription drug overdose. These are medications that doctors prescribe. And of those prescription drugs, most people died of an overdose caused by an opioid. And these are examples of opioids. So if you've worked as a medical interpreter for a while, I'm sure you've seen these names. Definitely hydrocodone, the first one, or Vicodin or Norco. And the last one, tramadol, which is a very common prescription drug that's used a lot in pain management or chronic pain, treatment of chronic pain, etc. Here I also put oxycodone. Oxycodone was, and it still is, the drug that has caused more overdoses in the United States in the last 5 years. This is changing, fortunately, and now the biggest drug that's causing, prescription drug that's causing more problems is fentanyl. Fentanyl is an opioid that's about 50 to 100 times more potent than morphine. There's even another one that's called carfentanil that's even, it's 1,000 times or more. It's usually used for anesthetic for large animals. And these are in the black market, and they are manufactured abroad. They're brought in this country, and people use them. They don't know exactly what it is, and a lot of people are overdosing. So about 91 Americans die every day of opioids, and the rate of addiction has increased tremendously in the last 15 years. This is stabilizing, and hopefully will start to drop. But I put this here because when I started as an interpreter about 18 years ago, and I went to chemical dependency, the people who will be in the program, most of the people are there for alcohol abuse, and there would be and other drugs like cocaine, back then methamphetamines. And there would be maybe out of 20 people, there would be 2 people who were addicted to Vicodin. That was 15, 18 years ago. Nowadays, when you go to chemical dependency, alcohol is still a big issue, but more than half the people are there because of prescription drugs, because of opioids. So learn a little bit, read about it. It's fascinating. It's interesting to know about what this opioid epidemic, and it will help you be ready for the appointment because you'll have some background knowledge and information that will help you a lot. So I'll go into the specific terminology. And what I'm going to do is I'll give you some medical terminology related to chemical dependency. For some of these words, I'll give you some examples of things that you would hear in chemical dependency, and I'll give you the opportunity to practice your interpreting at home or in the office, wherever you are. So drugs can be taken in many different ways. So why don't we do the following? I'll read this list, and as I read it, why don't you try to interpret these words into your language of service? Okay. So drugs can be injected, snorted, smoked, swallowed, eaten, or huffed. Drugs can be injected, snorted, smoked, swallowed, eaten, or huffed. Probably understand most of this in the list. Snorted means when people uh, take the substance through their nostrils, through their nose. And huffed, huffing means when people use different substances like aerosols, solvents, paint, gases, glue, those sprays to clean the computer screen. And what they do, they spray these products on a piece of cloth or a rug, and then they spray it, and then they place that cloth over their mouth and nose, and then they huff. They breathe in. So breathing in would be a good interpretation for the word huffing. So I'm going to talk about the most commonly abused drugs, and I divided the drugs into two categories: illicit drugs, more or less, and prescription drugs. So we'll start with illicit drugs, and I'll start with cannabinoids. And these are drugs that have effects like relaxation, slow reaction time, increased heart rate, and appetite. And here we will have marijuana and hashish. Marijuana, recreational marijuana is now legal in about 9 or 10 states. Medical marijuana is legal in about 29 states in the United States. So even though marijuana may be legal, recreational marijuana may be legal, at the state level, it's still considered an illegal drug at the federal level. So, and another thing is that nowadays there's something called synthetic cannabinoids or synthetic marijuana, which basically has some of the ingredients of marijuana, but it's laced or mixed with other chemical products. And if you listen to the news, I think this was last year, there was an episode, I think in the East Coast near, I forgot, one of the top universities there. 100 people overdosed the same day at the same park from synthetic cannabinoids. And what happened is that doctors are not familiar with these new drugs that come up all the time because the chemical ingredients change quickly, and this causes a lot of problems. Here in the slide, and this is, by the way, all this that you see here, all this medical terminology is one of the handouts that you will receive. You will see I put some slang in green type. So a lot of people don't say my drug of choice is marijuana. They might say grass or weed. So again, people use slang. So if you're interpreting for a patient and the patient says grass or weed, what you would do is you would use a slang word in your language of service for marijuana, which I'm sure there are plenty of them. Another type of illegal drugs are the opioids, and here we find heroin. So heroin and the prescription drug opioids come from the same product. Heroin obviously is an illegal drug, and opioids cause euphoria. Euphoria means a feeling of happiness, drowsiness, confusion, impaired coordination, etc. And heroin can be injected, sniffed, snorted, and smoked. And there are a lot of words, slang words for heroin that you can see here, like big H, horse, hell dust, and smack. Smack is one that I certainly heard. So again, if I hear that slang during the interpretation, I'll use a slang word in Spanish for heroin. It might not be a perfect equivalent, but it's a slang. That's all I need. Here we also have stimulants. These are drugs that create feelings of exhilaration, increase your energy and your mental alertness. Here we would find cocaine, methamphetamines or meth, and bath salts. Bath salts, they're called bath salts because they look like they don't, well, they come in this package and you can buy those in the, what they call the black internet or anywhere, to be honest. And it's packaged like it's a bath salt, something that you would use when you take a bath, but obviously it's a drug, it's a stimulant. And there's Also, again, lots of slang words for these kind of drugs, especially for cocaine. A lot of people might say coke. So, in Spanish, I would say coca, or in another language, you would say any slang word for cocaine. And there's a lot of amazing words for slang. So if you're interested in that, I'll give you this in your handout, there's a reference to this website where you can find lots of slang words for all kinds of substances. Don't confuse methamphetamines with amphetamines. Even though they belong to the same family, amphetamines are prescription drugs that are usually prescribed to treat attention deficit hyperactivity disorder and other conditions, also to lose weight, actually. So methamphetamines, illegal drugs, amphetamine, prescription drug. Here we also have club drugs. Those are drugs that cause mild hallucinations, emphatic feelings of emotional warmth. You feel good. You feel like you're in communion with the universe. You want to hug everybody. These are party drugs. So here we have MDMA or Molly or ecstasy. So MDMA, ecstasy, and Molly are the same drug. LSD or acid. And also that category of drugs, you probably have heard about this. They're called date rape drugs. Also, we have here hallucinogens and dissociative drugs. These are drugs that are very potent. They create very strong hallucinations. Sometimes people feel that they're being separate from their body, and they really impair your motor function. Here you would find ketamine and PCP, and also ayahuasca. It's a tea that I think comes from Brazil, peyote, and mushrooms. So those are the most common hallucinogens. And also here, again, lots of slang words for these kind of substances. And I provided some pictures here, but you can, again, if you're interested in this, the more you know about this, the more ready you will be in the appointments. I put this here because when you go interpret at a chemical dependency appointment, the patients in a group setting are supposed to do what's called a check-in. And a check-in, a very typical check-in, would be something like this. Hello, my name is Judit. I've been clean and sober for 58 days. My drugs of choice are weed, marijuana, weed, dope, and special K. And I feel great today. So the person said weed, dope, and special K. So they use slang instead of saying marijuana, heroin, and ketamine. So this would be an example and a reason why you should be familiar with the kind of substances and drugs that people are addicted to. And finally here, we have, as I mentioned, solvents, paint thinners, glues, aerosol sprays that people inhale or have for a high. Uh, Even though we talk a lot about opioids and methamphetamines and illegal drugs, actually more people die from alcohol-related causes annually than any other substance. So alcohol, in fact, according to the Center for Disease and Prevention, is the third leading preventable cause of death. So when you go to a chemical dependency, a lot of people there will be there because of alcohol abuse. I'll talk about prescription drugs. Like I said, a lot of people are in chemical dependency programs because they have an addiction problem with prescription drugs. And there's three main categories. We have depressants, and here we will have benzodiazepines. These would be medications that people are prescribed for anxiety most of the time, and also sleep medications. And the benzodiazepines, a lot of times what you would hear in chemical dependency, you would hear people referring to these as benzos. So people may say, my drug of choice are benzos. And that's what they're talking about. They're talking about these prescription drugs for anxiety. Then we have opioids. I already talked about this category. I just want to add here that when people refer to an addiction to opioids, a lot of times they say the word oxys. They might say, hello, my name is John, and my drug of choice is oxys. And oxys comes from Oxycontin, Oxycodone, which was the preferred and most widely used and abused opioid out there in the market. And but if people are addicted to other Percocet, Tramadol, etc., or opioids, they might use oxys. So, and in Spanish and other languages, you probably can say oxys as well. Here we have stimulants, and here we have amphetamines. Remember that a minute ago I talked about illegal drugs and methamphetamines? But here we have prescription drugs and we have amphetamines like dexedrine for attention deficit, hyperactivity disorder, and Adderall. Adderall is another stimulant or amphetamine that is lately, actually, there's a documentary on Netflix about Adderall if you're interested. And Adderall is a prescription drug that's very used and abused in certain settings. For instance, students who want to be up and study for 2 days in a row, or people who have very demanding jobs where they work 80 hours a week and they take this kind of prescription drug as a stimulant. And other compounds here included cough and cold medicines that have this component, the DXM, and especially teenagers, when they would start experiencing with a high, they would go to a pharmacy, get a cough medicine, and take huge quantities, and this creates some kind of high. So it would be like a gateway drug. Here in California, to purchase this kind of medications, you have to be 18 and older because of this problem. I'm not sure how it is in other states, but definitely there's more control now. All right, so I'll talk about some specific terminology related to chemical dependency. I'll say a couple of things about the words dependency and addiction. And as I go through these ones, try to think about how you would say these terms into your language of service. Dependency means that the body adapts to the drug. You have to increase the dosage to achieve the same effect. And the patient may feel or experience withdrawal symptoms if the drug stop. When you read this, you might think, well, this is addiction. It's true. But I would say that addiction has a couple of very specific characteristics. One is that addiction uh, shows that the person has a compulsive use that has harmful consequences. Addiction means that the person cannot stop. And addiction means that there's a negative impact on work and family. So, what's happening nowadays, and I notice in these settings, is that the word addiction is being dropped more and more. And instead of addiction, people are using dependency. Like the title of my presentation, it's not called chemical addiction terminology, it's called chemical dependency. But I'm really talking about addiction. So I just want you to know that this is a trend that I'm sure it also extend to other languages as years go by. That maybe in your language of service, it's more common to say addiction, and this might change in the future, where you may use more literal translation from the English for dependency. Codependent and enabler. So I'll give you an example of something that you would hear in chemical dependency, a sentence, and try to interpret in your language of service. Okay, so here we go. Your behavior truly shows that you are codependent. For years, you have been an enabler for your grandson. So what's a codependent? A codependent is a close friend or relative that makes it difficult for the person to stop or to get help for drug and alcohol abuse. A codependent is a person that sacrifices his or her own needs to take care of the person with the addiction. It's a person who doesn't want to rock the boat. So an example of a codependent would be children of parents who abuse drugs, and the children become the caregivers instead of the parent. the parents to be the caregivers. Or in a relationship, in a couple, the husband might be an alcoholic and the wife doesn't want to deal with it, doesn't want to send him or tell him to go to recovery because she doesn't want to rock the boat. She doesn't want things to get more complicated. When you're a codependent, you're exhibiting psychological traits, and usually you have to also go to psychological treatment. An enabler is a person whose actions allow the drug and alcohol abuse to continue. They're very similar, enabler and codependent, but a good example of an enabler would be, for instance, a grandmother who allows her grandson, who's addicted to heroin, to live in her basement. And she also gives him money. So that makes the addiction, that allows the addiction to continue. Withdrawal symptoms. So I'll give you an example of a sentence. Doctor, I don't know what's wrong with me. It's my third day in the program, and I feel tingling all over my body. I sweat a lot and I can't sleep. So these would be typical examples of withdrawal symptoms. These are the symptoms that the patient feels when the drugs and the alcohol are stopped or reduced. So when patients go to detox, that's the period, depending on the substance, it could be the period between 24 hours to 7 days or even more, where the patient goes through detox. And those are the symptoms that the patients feel. So it depends on the substance, but typical and common withdrawal symptoms are sweating, panic, insomnia, vomiting, anxiety, and even seizures. So like I said at the beginning, I would learn 2 or 3 of these lists. So I'm ready when the withdrawal symptoms conversation comes up. Doctor shopping and pill mail. These are terms that people may use in chemical dependency. And if you don't know what this means, you may be really confused because what's doctor shopping? Like, I'm going to go and like supermarket and buy a doctor. So I'll explain what that means. And doctor shopping means to visit several doctors to obtain multiple prescriptions of the same drugs, usually an opioid. So for instance, a person is taking OxyContin and has a bottle for 30 days, but after 15 days, that person used all the OxyContins and therefore needs more. So what that person may do is visit a different doctor and get another prescription. This is illegal, and this is called doctor shopping. This is kind of slang, but people definitely use it in chemical dependency. So how would you interpret that? So the way I would interpret that into Spanish is by saying what you see here on the screen. I would say in Spanish to visit several doctors to obtain several prescriptions of the same drug. It's very long. Doctor shopping is 2 words. To say it in another language, it might be 20 words, but this is how the best way to communicate the meaning of this. Pill mill is a doctor's office or clinic that prescribes medication, again, usually opioids, inappropriately or for non-medical reasons in exchange for cash. This is also illegal. So sometimes patients may say something like, my best friend recommended this doctor's office where I could get all the oxys I wanted. It was the best pill mill in town. So sometimes people refer to these doctor's offices as pill mills. Gateway drug, I'll give you an example of how this term would be used. I truly believe that marijuana is a gateway drug, and I will not allow my teenage daughter to smoke it in the house. So I truly believe that marijuana is a gateway drug, and I will not allow my teenage daughter to smoke it at home. So what's a gateway drug? It's a drug or substance that can lead to the use of more addictive drugs. So the gateway drugs per excellence are alcohol, marijuana, and tobacco. I just want to say that this is kind of like a theory. Some people don't believe in this theory. Some people don't believe that there are gateway drugs. Some people may not believe that marijuana is a gateway drug, or that by using marijuana, necessarily the person will also use other substances that are more addictive. But you certainly hear that, and you need to learn how to say that in your language of service. For those of you who are listening, translate, interpret, I'm sorry, into Spanish, this is all in the glossary. Setting boundaries. I'll give you an example of setting boundaries. In order to succeed in your recovery, you need to start by setting boundaries. So setting boundaries is to set limits, to set rules or norms of what's allowed in a relationship or a home. So examples will be, I won't allow any marijuana smoking in the house. I won't allow any friends who use drugs in the house. I won't bail you out if you end up in jail. And certainly you will hear setting boundaries. Setting boundaries is part of the recovery.